Hello and welcome to Doc Explain This, the podcast where we break down medical jargons using everyday language. I am your host, Dr. T. Welcome. I know it has been a while, but I am back like I never left, and today we'll be talking about diabetes. Now, heads up, this episode is going to be a bit different, but I promise you would enjoy it. So for clarity's sake, we'll be talking about diabetes mellitus. Yep. And now let me break it down. So think of diabetes as a famous uncle that has two sons, mellitus and insipidus. But mellitus is the popular one. So most times when people talk about diabetes, they are referring to diabetes mellitus, and this is the type of diabetes we'll be focusing on today's episode. So let's get into it. So if you Google diabetes, you probably read that it is a syndrome of impaired carbohydrate, fat, and protein metabolism caused by either lack of insulin or decreased sensitivity of the tissues to insulin. A lot of information, right? Let's start this way. And let's use what happens normally in the body to explain what diabetes actually is. So, when you eat food, what happens is that the body breaks it down into glucose, amino acids, fatty acids, vitamins, minerals, and water. And all of them are absorbed differently and at different points in the body. So, for example, for glucose, gotten from the breakdown of whatever carbohydrate component there is in your meal, it is released into the blood, and then a particular hormone called insulin, produced by an organ called the pancreas, welcome to Biology 101, helps to get the glucose from our blood into our cells so we can use it as fuel for our bodies. So you can think of insulin as maybe a patrol cop, a police officer. So as soon as it sees the influx of glucose in our bloodstream, it comes out and says, hello, welcome. This is the direction you are going into. You are going into the cells, don't stay in the blood. Now, you can see that when these things happen normally, so when you eat any food that has carbohydrates and is broken down into glucose, and when insulin is there functioning normally, everything is going on smoothly. There are no bad guys here. There are no culprits. But in diabetes, what happens is that after eating, the carbohydrates that have been broken down into glucose and the glucose that is already in the bloodstream have no insulin or too little insulin, or they are not even responding to the insulin that is in the bloodstream. And that is what happens in diabetes. In summary, there's either no insulin to guide those blood sugars or the glucose in the blood into the cells, or is either the insulin that is there is too little compared to the multitude of sugar present. So imagine having 2 cups trying to get people, maybe 1,000 or 3,000 people. 2 cups coordinating 3,000 or 4,000 people is not sufficient. Or you have a lot of insulin and they are not just responding. So those are the things that happen and lead to a condition known as diabetes. So are you still with me? Is this still making sense? Just hold on. Now, in one of those situations where there's actually insulin, but then the issue is that the blood sugar is not responding to the signals of the insulin, what happens is that the pancreas will continue to secrete more insulin to try and grab the attention of the blood sugar. And over time, the body will now sort of require more insulin to generate a response. So imagine where you have like maybe a crowd of 10,000 people and you only have maybe 20 police officers and they are trying to call the attention of people, but their voices are not loud enough. So what happens? The police force deploys more people there, and then you now need more police officers to be able to coordinate the people, in that field. And what happens eventually is, if the population of people there keeps growing, then it becomes more difficult. No matter how many police officers are deployed, it becomes more difficult to manage. So that condition is known as insulin resistance. So basically, the blood sugar or the sugar gotten from the carbohydrate component of your food is resisting insulin's coordination, insulin's instruction, insulin's signaling. And that is usually one of the precursors or one of the first things that we see in people that are pre-diabetic. And those are one of the few things that we actually look out for and we encourage people to be more sensitive about. Now, so based off my sweet explanation of what diabetes is, we have broadly two types of diabetes. So this is generally speaking, we have two types. There's type 1 and there's type 2. Type 1 diabetes is usually due to situations where the body isn't producing insulin or very, very little insulin. And it's because of either inherited genes or due to autoimmune diseases. So diseases that arise from the body attacking its own cells. So in this case, the cells of the pancreas that produce insulin are actually attacked. So that's type 1 diabetes. And the type 2, the second type, is actually due to a decreased sensitivity of target tissues to the metabolic effect of insulin. So basically, it's due to reduced sensitivity of the cells to insulin's coordination of sugar into them, which I already explained as insulin resistance. So type 2 diabetes is due to insulin resistance. Now, if we do a quick comparison of the two types, type 1 diabetes is not preventable per se because in most cases it's genetic, and when it happens, so it's genetic, you inherit it from first degree relatives, so your fathers, mothers, so that's how those set of people inherit it. However, when it happens randomly, most times it's associated with an autoimmune disease, and autoimmune diseases are not things that you can generally prevent. So type 1 diabetes is not preventable, and we usually see it in people less than 20 years old. So people younger than 20 years old. So we usually see them in children, teenagers, even babies. You'll be surprised. And most of them have a low weight. So they are not chubby or fat. They usually appear skinny. Yeah, that's the right word. So they are skinny to normal weight. And if we do a blood test for them, what we'll see is that their insulin levels is either 0 or very, very little, too minimal. And for this type of diabetes, the treatment is always insulin. And the good thing now is, in a general scheme of things, this type of diabetes probably represents maybe less than 10% of all the cases of diabetes in the world. So it's quite rare. Now, the type of diabetes that we see more commonly is a type 2 diabetes. And the good news is that this one can be prevented. Now, we usually see it in people less than 30 years, and there's a peak age of incidence, or a peak decade of incidence, which is usually between 50 and 60. Now, typically, these people are overweight or obese, and as a result of diabetes, then they begin to experience unintentional weight loss. Now, when we do tests for these people, their plasma insulin is usually normal or high. So when we do a blood test, their insulin levels can be normal to high. Remember, the issue with these people is that there is insulin, there's just insulin resistance to the blood sugar. For this type of diabetes, treatment usually is weight loss, or there are also medications that can be used, lifestyle changes, diet changes, and in some cases, we might need to administer insulin for management if they are not responding to the medications that we have. Now, I just want to quickly speak on some of the causes of insulin resistance. Number 1, obesity or being overweight. Now, the reason why this is important is because how people store fat is usually different, but it gets to a certain level of fat buildup that you would actually start to pack fat in certain areas. It cuts across everyone. So for example, there are some people that when they initially gain weight, they gain weight maybe in their arms, their chest, their hips, bum, stomach. It's not everybody that goes to stomach first or the tummy area. But eventually, there's a certain amount of fat that you pack on. That if before your fat gain only goes to your hips or your arms or your cheeks, it will now begin to go to your stomach. And when it gets to that stomach level, that is the issue. Why? Because fat around the organs, what we call visceral fat, actually affects insulin signaling. So imagine with our case of having a large crowd and us deploying just a few police officers to coordinate. Imagine there's now like a large barrier between these police officers and the people they are trying to coordinate. They won't hear them properly when they are talking. So it makes things more difficult. So even if the people that they need to coordinate are not that much, maybe let's reduce it from 10,000 to 1,000, but you only have 50 soldiers. And there's now a huge barricade in between them. Imagine if the barricade is now made of something like steel. No matter how much the police officers shout, the people there will not hear. So that's the issue with fat, especially around the stomach area, the belly area, what we call visceral fat. That is how it affects signaling when it comes to insulin. Also, use of certain medications like steroids can lead to insulin resistance because of the way steroids actually work. So this one, if I go into it, is going to be a lot of jargon, but just believe me, using steroids, especially steroids that you swallow or steroids that you inject, science has proven without any doubt increases your chances of developing insulin resistance. Then there are also some conditions. There are also some medical conditions that we know that when people develop them, it increases their chances for insulin resistance. And most of them are actually like diseases that come in communities. So for example, autoimmune diseases. We've discovered from experience or from history that when people have autoimmune diseases, where their white cells are fighting their normal cells in different areas, we know that it tends to also target the pancreas. So in those people, apart from all the other medical conditions that they have, we also see insulin resistance. Another medical condition in which we see an increased risk for insulin resistance and insulin resistance actually is a condition called PCOS, fully known as polycystic ovarian syndrome. Now, anytime you hear syndrome, this is a tip from me to you. Anytime you hear the word syndrome, it means there are plenty. So it's not just one thing that is wrong with the person. There are other things involved. And with patients that have PCOS, one of the things that actually happens to them is that they have insulin resistance. And as a result, most often than not, they're either pre-diabetic or already diabetic, and they need to be on medications to target the insulin resistance itself. Also, there are genetic diseases. There are loads of genetic diseases that affect insulin receptors and eventually lead to insulin resistance. So having said all this, what happens when people actually have diabetes? So basically, what are the symptoms? What are the signs? What are the things that we observe? Now, to give us a clearer picture, I will just explain this way. So, let's go back to the origin. Sugar in your blood after you've eaten, which is completely normal because all the carbohydrate component of your food has been broken down. That is normal and it's in your bloodstream. In a diabetic person, there's either no insulin or the insulin is too little or there's insulin, but there's insulin resistance. So the blood sugar does not go into the cells because it doesn't obey the signaling of the insulin. What happens is that water and sugar sort of have a relationship. Wherever there's sugar, you'll find water. Water will always come and meet it in the body. Now, if all the sugar, if they are not obeying the instructions of the insulin for them to get into the cells, they remain in the bloodstream. But what happens is all the water in the cells will now move to go and meet the sugar in the bloodstream. And as a result, there is pooling of water from the cells into the bloodstream where the sugar is, and then the cells become dehydrated. Also, as there's now a lot of sugar and a lot of water in the bloodstream, I don't know if you remember from the episode on hypertension how the kidneys work. The kidneys will always try to come in and save the day. They are like your best friend. You just need to give them small signal, they get it. So the kidneys will jump right in and be like, what's going on? There's a lot of water in the bloodstream. There's a lot of sugar in the pipes. What is happening? Okay, let me help you. Let me try to excrete some of this sugar, since that is what is causing the issue. So the kidneys will now try to excrete some sugar. And as sugar is leaving the body, water too will follow it, because like I said, they are 5 and 6, they follow each other. What happens, or what the person would experience, because you will not know that all of this is happening in your body, but what you will see, or what people that have diabetes notice, is they have increased thirst. They feel very thirsty because remember, the cells are dehydrated, they've lost water. Then they pee a lot. They urinate more than normal. Why? Because the kidneys are trying to excrete that sugar, and along with the sugar, water also leaves the body. So they always feel the burden to pee. Now, let's go back a bit. You know that all the sugar is still in the bloodstream. It's not entering the cells. And if you remember my story of how the body functions normally, this sugar actually needs to get into the cells because we need that sugar for fuel. We need that sugar for energy. In all the different cells, the cells need that sugar to function. Now, if that sugar is now deciding to stay in the bloodstream, is not listening to the instruction of insulin, then there is no energy. There is no fuel for the cells to do what they're supposed to do. So generally, people that have diabetes, they feel tired. They feel exhausted. Their body is not working the way it's supposed to work. They have unexplainable fatigue. Now, another thing that happens with time is that the body will always try to compensate, try to help. So you can imagine if you have 1,000 people that are meant to be in a particular space, but they are meant to be in a particular space for a limited period of time. However, the police officers are unable to coordinate them into the inner rooms they're supposed to go to, so they end up staying in that space longer than normal. So what the body will try to do is, okay, where are the places that some of you can go, just to reduce the burden in this area. So what happens is that some of this blood sugar that is in the bloodstream or blood vessels, over time, they start to back up into other areas of the body, other organs of the body. And in the process of doing that, the spots that they like are the eyes, the blood vessels around the eyes. They like the nerves. They can make pockets along the bloodstream. Imagine it's tight. So you need space, so you stretch it a bit, damaging the integrity of the walls of these blood vessels. Also, the kidney is already stressed, so it also affects the kidney. Long story short, diabetes, especially when it's undiagnosed, there's no treatment, there's no change, nothing is happening, it does affect the eyes. It affects the kidneys. It affects the heart because it compromises all the blood vessels. It can affect the nerves. So that's why we see a lot of issues with people that have diabetes after a while, especially the ones that are not being treated and they've gone on for so long, they have issues with sensitivity. They don't feel things anymore, and because of that, they become really prone to so many, accidents. Also, because I mentioned that diabetes also affects the blood vessels, it damages their integrity, and it affects mostly the blood supply to the lower limbs, because there's reduced blood supply to the lower limbs. Blood supply is necessary not just for nutrient supply to all the various areas of the body, but also for things like healing, because you need blood to heal. When blood flows to certain areas where there are cuts or injuries, it comes with the necessary nutrients and healing is able to take place. So in diabetes, the integrity of the blood vessels have been compromised, so there's limited blood supply. So peradventure, if there's any form of cut, accident, any need for wound healing, especially in the lower limbs, there's reduced blood supply. And as such, wound healing becomes difficult. And that is why, sadly, diabetes is one of the most common causes, if not one of the high-ranking causes of limb amputation all over the world. It is one of the reasons why limbs are being cut. Why? There's reduced blood supply to the limbs. When there's a cut, when there's an injury, when there's something that needs that blood supply, the blood supply cannot come, or it comes very poorly. So the wound lingers for so long. And in most cases, when a wound lingers for too long, it becomes infected. The infection becomes worse. Even when you use drugs, the delivery system is very poor. So there's nothing you can do. The best solution will be to, let's cut it to the point where the blood supply is still a bit okay. So that is what happens in diabetes. Also, like I mentioned, when the blood sugar begins to back up in certain areas, it likes the nerves too. And it can affect them. It can affect nerve functioning. It can affect things like sensitivity. Imagine somebody holding something that is very hot and they can't feel it hot. Imagine somebody using a pin to poke someone and they can't feel it, because the integrity of all their nerves, especially towards the ends of their limbs, their hands, their legs, it has been affected. Now, beyond that, it can also affect the nerve functioning of certain organs. Now, this one, it's not unfamiliar, but it's not the way you hear it. Let me explain. So, also, diabetes can affect the nerve functioning of certain organs. So, it can affect the nerve functioning very commonly in men in an area called the penis. So, men can experience erectile dysfunction as a result of diabetes. Now, I'm sure what you have heard is probably things like, oh, as a man, you should not drink too much Coke. As a man, you should not be taking sweet things. It's not good for you. That is not good for you. And not drinking Coke and Fanta as sweet things. What they are trying to explain, but could not explain how that happens, is through diabetes. Also, diabetes can lead to unintentional weight loss. Now, usually these people start off very overweight, very much obese. But what happens is that because the blood sugar, I told you that blood sugar, there's a reason for it. The body actually needs it. We need it for fuel. We need it for energy. Now, what happens is that because that sugar is not entering the cells now have to look for other ways to make energy. So basically, it's like what you are eating, the carbohydrate component of what you are eating is not even getting absorbed. It's just there. It's just sitting there in your bloodstream, causing havoc. And your body needs this energy. So what does it do? It looks for the next best thing. It begins to break down all the fat that you have stored up, all the fat that was making the person obese and fat. It begins to break everything down. After it is done with that, it begins to break down muscle so that it can release amino acids. And it's so painful because amino acids on a normal day, the body will never break down for energy. It's precious to the body. The body likes keeping protein. It likes keeping protein to build up the muscles. And it's very vital. But then what you see in these people is the body will break down fat. the body will break down the protein. So they go from being very chubby to being very skinny, almost wasted. This is not weight loss that the muscle integrity is preserved though. No, this is looking wasted. When you see these people, they look emaciated. They look like a lot of things must have happened to them. Those are the kind of people that you see that you saw them like 2 or 3 months ago, they were looking okay. Now they are looking like a shadow of 2 or 3 of their former cousins. And you're asking yourself, what exactly happened? Now the thing about this weight loss, if you pay close attention to it, it is unintentional. So this one is not the weight loss from gym. It's not the weight loss from diet. It's not the weight loss from doing anything intentional. It just happens. You just notice that this person keeps losing weight. So please pay attention to your weight loss, especially if you are not doing anything to warrant the weight loss. If you are married, maybe you can ask your wife or your husband. Maybe they are helping you one way or another. You don't know. Maybe they've altered your diet a bit. But if none of that is happening and you're experiencing weight loss, please look into it. It's very important. So in summary, the symptoms that people experience with diabetes, I know I've given people a long, sweet story. The symptoms that people experience with diabetes: increased thirst. They're always thirsty. They always want water. There's also frequent urination, so they pee more than normal. Then there are symptoms associated with the organs that have been affected. So blood vision. Your vision is not as clear as it used to be. It's not as if some of you have never gone to see optometrist before. So you don't even know if you even have 20/20 vision. So even starts with, but God will help us. That's not the major focus. The focus is blood vision. Apart from that, there's also the feeling of tiredness. They just feel tired. No matter how much they eat, they feel tired, they feel weak. Then there's also the unintentional weight loss that you cannot explain. So also, like I mentioned, because of the long-term effect, there's also issues with developing things like wound ulcers due to issues with blood supply as a result of diabetes, and that in itself can lead to limb amputation if not properly managed. There's also increased risk of things like stroke, increased risk of things like heart attack that come, and of course kidney failure that come with diabetes. Now, I have said all these things because I need to bring you to this point. The burden of diabetes right now in the world is scary. As a medical professional, to you, my friend, you do not want to have diabetes. You do not want to be part of the numbers. You do not want to be in a condition or a situation where you are missing body parts, and it's because you could have made a better decision. What we are seeing now is that the numbers are increasing in an astronomical way. For context sake, about, let's say, 5 years ago, or between 5 and 10 years ago, we had maybe like 200 million cases. As of last year, we have almost times 4 of that amount. Almost 1 billion people living with diabetes. Now, before you think, oh, but it might not... Wait. You remember I told you that right now, at least 90 to 95% of the cases of diabetes is type 2 diabetes. So it's not even the one that you don't have any control over. This one you can prevent. And it's rather sad to state now that the peak age of onset was between 50 and 60. So that's where you found the bulk of people between 50 and 60 years. But now, the age of onset is even younger. We're now having people, teenagers, having type 2 diabetes. We're having young adults, people in their 20s having type 2 diabetes. So it's becoming scary. There are times that before we will say, oh, if we see certain things, we'll see it in a certain age population. All of that is changing. Between me and you, it is changing. Even the younger people are having it now. So it's not something that you can say you want to procrastinate or push till a certain decade to be more interested in, or push to a certain decade before you take action. My brother, my sister, it might be tomorrow or next tomorrow. Don't worry, it's not your portion, but you get what I'm saying. Now, the thing that also makes the situation even worse is that most of the people that actually have this disease, they've not received any proper diagnosis. Some people don't even know because, number one, you're never paying attention to your body. You're not doing anything. You notice that you pee quite a lot. You are thirsty. You attribute it to weather. Okay, it was harmattan, it was dry season. Even in rainy season, there's no improvement. It's worse. You are not doing anything about it. Only you get up at night to pee like 5 times. During the day, you are always in the toilet and you think it's normal. It isn't. It's just, when I talk about it, I don't know how not to be as passionate as I am, because when you've seen a disease to be, or a condition to be the author of a lot of other unimaginable loss in people, and then the fact that you know that it could have been prevented, you have no other choice but to be passionate about spreading the information. I've seen people lose eyes due to diabetes, lose their sight due to diabetes. I've seen people lose limbs due to diabetes. I've seen people need kidney transplantations. I've seen people spend all their resources on dialysis, and it's not because there was something fundamentally wrong with the kidney. No, kidney was just trying to help. But then it found itself in a situation where the help that was trying to provide overwhelmed it, and it packed up. A lot of people, there's nothing fundamentally wrong with their heart, no, but they're having heart attacks. The way the people that have diabetes have heart attack is even different from the normal population. Most of them don't even know. Most of them think it's like a stomach pain. They are not sure where the pain is. So before they even get help, most cases it's always fatal. They've died. Because people don't even know how to help them. They can't explain their symptoms very well. It takes a very good doctor to signpost that, this thing you are explaining, let me not rule out heart attack. Let me not rule out that there might be something wrong with your heart. I have also seen diabetes being the cause of stroke. So, it actually affects people. And if you think that, okay, when it affects you, your life is your own, you can't do as you please, you don't want to be in a situation where people around you also have a reduced quality of life because of what you are going through, which is what I see. When the burden of diabetes comes upon someone, it not only affects them, it affects their family members. Now, beyond this, the key message I want you to hold on to is that a bulk of diabetes can actually be prevented, and there are things that you can actually do. You are still in control. There are things you can do. I've given you sad numbers to explain how bad situation is, but there is still hope. And part of this hope is this information that is coming to you, not just meant for you, meant for your friends, family members. So you better be sharing this with people so that they also know. And you that you have received it, listen to it. Because the person that sent it to you is trying to tell you, at 60, I don't want to be carrying you up and down for dialysis that is due to diabetes. I don't want to be carrying you up and down looking for treatment. I want you to be able to walk with your 2 legs when you are 70 and not have lost a finger or a toe. So please, listen and follow through. Is your life, it's not my own. Do the right thing. Now, when it comes to diagnosis of diabetes, very swift, easy. Technology and science has made things so easy and convenient for us. Even at the comfort of your home, you can have the test done. A lot of people have a device called a glucometer, a small one handy in their homes, and you can check it. Some of these glucometers, they come with guides. So if you take your time and read the guides, you can interpret the results and know where you stand. But for the sake of spreading generalized information to everybody, there are tests that can be done to diagnose if someone has diabetes. The first one is just a random blood sugar test. You can walk into a lab. There are even people that hawk these things on the road. Between me and you. You can walk into a pharmacy and tell them, oh, I want to get a blood sugar test done. You can call your GP and say, hello, I want to book an appointment. I want to check my blood sugar. I'm age 30, I'm age 40. I've never done a blood sugar test before. I need to know where I stand. Go in and have the test done. There is the random one that can be done at any point in time. To get more accurate picture of where you stand, there's the fasting blood sugar, in which you will be told not to eat for a certain amount of hours, usually overnight. And then there's also something called a glucose tolerance test, in which after they've taken the blood sample from when you have not eaten, the fasted state, they will now give you like a really sugary drink to take. After taking that, we'll now take another set of blood draws from you. Why? We want to see how your insulin, the insulin that you are producing, is responding to the blood sugar that's been given to you. So we do this latter type of tests to be able to diagnose if someone actually has diabetes. Now, to understand the burden of how the person has been over the last 3 months or 120 days, usually there's another test called HbA1c test. So if on the spot of doing maybe a fasted blood sugar test and a glucose tolerance test, we discover that you're pre-diabetic or your values are diabetic, then we recommend doing an HbA1c test to see if truly that has been your state for at least the last 90 to 120 days. There's also the urine sugar test, because I told you the kidneys will also try to excrete the sugar. And usually we do not expect to see sugar in people's urine because the body needs the sugar for functioning. So there's also the urine sugar test that can also be done. Then at the point of diagnosis, which is very important, so if you are discovered to be pre-diabetic or to be diabetic, it is important that you stress to your doctors or whoever it is that is managing you, the nurse you are seeing, or preferably doctors, please. It's important that you stress to them that they assess all the other organs that are easily affected by diabetes. So ideally, if you receive the diagnosis that you are pre-diabetic or you are diabetic, you should also see an optometrist. You should see an ophthalmologist. They need to look into your eyes to see how the blood vessels that are supporting your eyes, how they're functioning. A lot of people, like I said, think they have 20/20 vision, but they don't. And one of the earliest signs of diabetes is blood vision. There's compromise to the eyes. So at the point of diagnosis, you should be seeing those other doctors. You should be seeing those other specialists. Have your eyes checked out. They will also do some blood tests to check your kidney function to see how your kidneys are functioning, if it has not been compromised, so that we can preserve the function as much as possible. They will do a complete physical examination of your body. They will assess your nerve function to see if they are still there. And based on that, they can counsel you adequately. There is no need to be afraid. If you receive the diagnosis, there is still hope. As far as you are not dead, there is still what? Hope. And there are still things that you can do to preserve the quality of your life. Now, receiving the diagnosis and not doing the necessary things is what makes things worse. So there is still hope. When there's life, there is hope. Now, the major question for all of us Gen Zs, millennials, those of us that were certain and we are sure because we have done tests too, not because we feel like it or we look like it, but those of us that were certain that, okay, we don't have diabetes, we're not pre-diabetic. How do we prevent ourselves from getting this diabetes? Number one, for the type of diabetes that can be prevented, it starts with lifestyle changes. It starts with food. Yes, food. And before you start thinking that diabetes is only cubes of sugar, Coke, Fanta, junk food, in quotes, please sit down. That's not all that is involved. It starts with food. Not just saying, oh, I want to prioritize one food group over another group, which is what I see a lot of people do. They'll say, oh, I'm not eating carbs. No carbs. I'm not eating this. I'm not eating that. No, you need carbohydrates. So it's not just the food types. It's also your relationship with food. A lot of us think we have healthy relationship with food, and we don't. There are people that binge eat, so you eat based on your emotions. A lot of people have a gluttonous relationship. Yes, gluttonous relationship. The amount of food that you are eating is not what you actually need. A lot of people cannot exercise self-control with food. Now, all these things, when we are saying healthy diets, it's not just saying broccoli, salad on your plate. No. It's also how you approach food and what you think about food, how you eat the food, the frequency, the portion, the quality. All those things contribute to what makes your diet healthy or not. So, to prevent diabetes, number 1, eat healthy. The quality of your food matters. The quantity of your food matters. The frequency of your eating matters. The portioning of your food matters. As a rule of thumb, we always say, reduce. Because if I say avoid, some of you squeeze face. Reduce your intake of simple sugar, pure sugar. We mean table sugar, like your cubes of sugar, powdered sugar, icing sugar, the sugar that you are seeing. Let's start with the one that you can see. Before you start accusing all the hidden ones, let's start with the one that you can see. The one that you scoop inside your tea, your coffee. The one that is dusting, that they dust on top of your donuts and your cake. Let's start with that one. Yes, glory be to God. All of us will collect something today. Yes. So, we always say, avoid it. But avoid can be a big word, and some of you are squeezing face. Okay, reduce it. Is that okay? Reduce it. Then also, reduce intake of saturated fats in any way or form. That's another one. People would rather go and be checking labels. And the amount of oil and fatty food that we consume, that we can see with our own koro eyes. Okay. But as a general rule of thumb, please eat healthy. And when we mean eating healthy, we mean watch your quality of food, watch the quantity of food, your portion size, watch your frequency of eating. All of these things matter. And if you notice a pattern with food, you only eat when you're happy, you only eat when you're sad. All these things, they're important. Very, very important. Your relationship with food is a big deal for a lot of conditions, especially a condition like diabetes. Now, another thing that we can do to prevent ourselves from getting diabetes is to reach and keep a healthy body weight. Now, reach and keep, those two words are important. Why? Because one, if you're overweight, if you're obese, if you're fat, let's admit it. Know the truth. This is the truth that is setting you free. Know it. Are you obese? Are you fat? Are you fat? Are you heavy? You have to lose weight. You have to reach a healthy body weight for your stature. There is a healthy body weight for your stature, not just by how shapely you look, but there's actually a certain amount of kilograms that your weight should be between a healthy range. I'm sure you might have heard about things like body mass index, BMI. For your height, there's a certain amount of weight you should carry. So it is important. So that helps to guide us. Now, you have to reach a healthy body weight, so you have to lose weight. And once you've lost weight, you have to keep that body weight. You have to protect it. So you have to stay within the normal range. You know, it does a lot of harm to the body to be fluctuating up and down. It also affects the body. So let's try as much as possible to stay within that normal range. It's important. So reach a healthy body weight and keep it. So it's key. And part of the reasons is because, I spoke earlier about carrying fat in your stomach area. Usually when people carry fat in their stomach area, it also means from appearance that they might actually have fat around some of their organs in that area. So it's very, very important. And when I'm talking about fat in stomach area, this is not fupa that women have as a result of pregnancy and then stretching of pregnancy and loose skin. No, this is actual fat in that area. And between me and you, because when you pinch it, you can feel it. When you touch that area, it's abnormally tight. So there's something inside. It's not baby, but there's fat inside. We know. And if you are not sure, there are blood tests that you can do that can give you a clinical picture of what is happening in your body with regards to fat. If you're actually packing in fat in certain areas, you can get that information from certain blood tests. Also, you have to stay physically active. Wow, I won't stop there today because usually people stop at stay physically active. No. What I mean by physically active is at least 150 minutes of moderate intensity exercise per week. See, if I can put caps lock on what I just said now, these are the things I'll be capitalizing. Stay physically active. Please, can we circle the 150 minutes? Capitalize moderate intensity. And finally, per week. Why? Because 150 minutes is what? 30 minutes for 5 days out of the 7 days in your week. I'm not telling you to do high intensity interval training. I say moderate. Moderate is what you need to do. So if you are thinking the bar is so high, it's actually not. You just need to be consistent and disciplined, and you need to do the right thing. So now it doesn't take that much. You can actually do it. Think about it. It's 30 minutes 5 times a week of moderate intensity. I'm not saying run up and down. I'm not saying you should go and be carrying 50 kg or carrying your body weight. Moderate intensity exercise. 30 minutes 5 times a week. Also, we recommend don't smoke tobacco. That's the only thing that's in this world. On the packet, it boldly advertised smoking kills. One of the ways it kills is it fans the flames of insulin resistance and eventually diabetes. So that's one too. Okay. Then this last point, I want to emphasize it because you see, the truth that sets you free is here. Okay? And I feel like a lot of people, they know, but they are not aware of how important this last point is. Now, if you notice a familiar pattern, so your daddy has diabetes, or your mommy has diabetes, or your sister, or your brother, uncle might be far, but if you notice it, please pay attention and start putting systems in place for your own sake. It is not just their problem. It is your own problem too. Apart from the fact that you are spending your finances to help them, there's also the risk that you can also develop it. And this risk is very important. Apart from the fact that there's a genetic component to diabetes where it can actually be inherited, both types can be inherited. There's also a key factor that people always downplay, which is why some of these things are actually familiar. And it's the fact that you have shared habits with your family members. Shikena, let me explain. You grew up in this setting. You eat the way they eat. You think the way they think. You process things the way they process things. You carry that, you start your own family, you pour it in. This is how we eat. This is how we do. This is our culture. This is our style. This is our this. This is our that. This is what is expected. All those things are the things that you carry. It's not just genes, so these are the habits that stay with you for life. So I said all of that to stress the fact that The way you eat too can be passed down from father to child. And the way you eat, your diet, your lifestyle, it contributes to a lot of these diseases, including diabetes. So it might not just be the gene that you inherited from ancestor that we will break today. It is also the shared lifestyle, the way, the pattern, the portion, all of that, what you are accustomed to. All these things are also the factors that matter. So if you notice, that's what happened to uncle, that's what happened to my dad, and the two of them, their favorite food is the same thing, my dear, you don't need to look so far. And you have started developing a liking for it. See, it's important. Pay close attention. Whatever affects them can also affect you. And you can deal with it. You can put systems in place. So it is very important. Now, this is probably the sweetest part of this episode, because or the sweetest turnaround of this episode. I come with good news. Woo! And the good news is this. If you have been diagnosed with diabetes, or if you are pre-diabetic, type 2 diabetes, if caught early, and if you actually do the necessary things, it can be reversed. Somebody say glory. Yes, it can be reversed. But between me and you, before you get so excited, it's very, very important that I emphasize the fact that it's you have to be disciplined. You have to be consistent. See, to reverse it is not chicken change, or it's not beans. The fact that it's there, let me tell you, it is hard, but it is doable. You have to be consistent. You have to be very disciplined and determined, if I might add. So what are the things that you need to do? Number one, please, as soon as you've been diagnosed, or as soon as you've been told, if they have placed your medications, use it. Doctors don't place your medications for their own pleasure. It's for your own good. So if you have been placed on medications, use your medications as prescribed. And when I mean as prescribed, the amount, the correct dosage at the right time. If for any reason you don't like the drug, or you are experiencing certain side effects, please discuss with your doctor. There are so many medications now that we have for the management of diabetes, or accommodate you depending on whatever side effects that you have. But it is important that you use the medication first off. Use the medication. Also, make sure that all the lifestyle changes they discuss with you, you are actually making these changes. Drugs are not magicians. Okay? They will do their own. You too, you must do your make the lifestyle changes. Also, I told you, at the point of diagnosis, make sure all the organs that are affected when it comes to diabetes, you are evaluated. So, as soon as you receive the diagnosis, please look for an optometrist or an ophthalmologist. Go for regular eye exams. Make sure they examine your body thoroughly. They check your nervous system. How is it functioning? They run tests for your kidneys. They check your heart. They check every organ that is connected to this condition to assess where you stand, so that we can preserve the quality of your life. We might not be able to reverse you back to where you were before you came, but at least let us keep you at the point at which you are. Okay? So it is very, very important. Now, also, because of the peculiarity of diabetes, it is also important, if you've been diagnosed, please always cover your feet. Always make sure that after you shower or you wash your feet, you inspect it, look at your legs, wear socks, cover your feet in the house. Even though, yes, you're in the house is clean, please. Why? Because it reduces your chances of developing any cuts or any wounds. And of course, when there is no wound, we will not be bothered about wound healing. And that, of course, when we are not bothered about wound healing or formation of ulcer or anything, there will be no talk of amputation. Please, let us prevent it as early as possible. let's do the necessary. Send this podcast to as many people that you know, your friends, your loved ones, people that you even know that are diagnosed with diabetes. Because this portion of the podcast now is very important. There are things that can be done. It can be managed. It's not a death sentence. Like I said, the aim is to try as much as possible to reverse it and to maintain your quality of life. There's so much you can do. Okay, so it is very, very important. So at this point, since I've said you should spread the love, don't forget to like this episode, subscribe, comment. Please follow us on all our social media pages. Please subscribe to our podcast. It's on YouTube at Doc Explain This. Please subscribe, like, comment, send us questions. Please follow us on all socials. We're on Instagram at Doc_Explain This. Also on TikTok at Doc_Explain This. Please send your questions. Enter our DMs. We don't segregate though. Please come in, ask as much as you want.